All right. So we're going to go ahead and start the class today right at 9:30. So I think most of you are based in India right now, as well as we have a few from all over the world. So what we're going to do today is go over essential oils for maternal wellness. So my name is Zarine Bharda, and then our main presenter is Stephanie McBride, who has an education and specialty in essential oils for maternal wellness. So she'll do a full introduction shortly. So here what we're going to do is we're going to talk about how to use essential oils for the mama, baby, as well as I will give you a basic overview on how you can use essential oils for the whole family as well. So a little bit about myself is I'm a mom of 3. I'm the founder of Healing Oilistic. I've been using doterra essential oils for over 6 years now. And my passion is to basically guide people to empower themselves for overall health and wellness. So to get started, we'll go over the 3 cool things about essential oils. So if anyone wants to type in the chat box, have you used essential oils before, or have you been exposed to essential oils at all in the manner of actually the pure and potent form of them? That's kind of where I'm sure everyone has been exposed to essential oils in a sense in perfumes, moisturizers, creams, but that's where it is completely different than the kind that we're going to be talking about today. So these are certified pure therapeutic grade. So that's where they're 100% safe. There's nothing added to them. There's nothing removed from them. And that's where it's very important when you're going to be using essential oils for maternal wellness. You want to ensure that they are safe as well as that they're potent and that the therapeutic qualities are there. And that's where doterra has the testing behind each of their essential oils, where it's very transparent. You're able to see that there's nothing adulterated. There aren't any chemicals that are added in, as well as the toxicity levels are pretty much nil. So the second thing about essential oils is that they're very effective. So when any of you have maybe been sick before, when you get the cold or the flu, basically the doctor just either gives you antibiotics if it's a bacterial infection, or if it's like a virus, what they'll do is they'll tell you, okay, just go home, get lots of rest, drink lots of fluids. So that's where you're able to use essential oils to actually support your system, whether it's your immunity system or your respiratory system. And especially when you are pregnant and your immunity system is already compromised, this is where you're able to use essential oils to support yourself. So On Guard is a great blend. I know during all 3 of my pregnancies, I diffused it all the time. And it's a blend of citruses, cloves, cinnamon, and that's a great one to just diffuse and kind of cleanse the environment. And that's where it's very effective because essential oils have a cellular, essential oils are oil-based. So they're actually able to penetrate through the cell membrane and get into the oil barrier. So that's where they're a lot more beneficial in terms of supporting the body versus antibiotics, which are more water-based. Then the third way is that essential oils are very affordable. So when you break it down drop by drop, you're actually able to see that these are a lot more cost effective than buying either over-the-counter medication, as well as taking time off work, paying your copay, depending on where you are in the world, or paying for the prescription as well as for the doctor's visit. Where, for example, if someone has an ear infection or if your child has an ear infection, using just 2 drops of lavender and 2 drops of melaleuca, tea tree oil, which are diluted, and just rubbing those behind the ears, that actually works out to be around 44 cents in US dollars in comparison to all the time and the energy that you would be going through and the money that you would be spending by going to the doctor and getting those antibiotics. And that is where just using the right essential oils is very safe, effective, as well as affordable, and you're able to receive the benefits within minutes. So 3 different ways to use essential oils. So I'm going to go over all 3 of the ways. However, Stephanie will be focusing more on aromatic as well as topical, specifically for use during pregnancy and for maternal wellness. So for aromatic, you have what a lot of you may be exposed to, diffusing essential oils. So if you don't have a diffuser, it's a great way to diffuse an essential oil, as well as not only give it benefit to the single user, but anyone else that might be in that room. And that's where it's really beneficial that way. If you don't have a diffuser, you can always just put a drop in the palm of your hand, cup your hands together and just hold it in front of your face and take a couple deep breaths. That's a really good diffuser, and that's something that you can always do on the go as well too. The second way is topically. So when you're applying essential oils topically, you can either apply them to the affected area, or you can always apply essential oils to the bottom of your feet. So the bottom of your feet are always recommended because that's where your pores are going to be the largest, and your body is actually able to absorb the essential oils and utilize those within about a couple minutes. And it's actually metabolized into your body within about 30 minutes. So when you're using topical use, one thing to take note of is dilution. Especially during pregnancy, dilution is very key because of the fact that your skin is going to be extra sensitive or more sensitive than what is normal. So that's where you can always do a test patch when you're starting out, as well as for babies, their skin is also a lot thinner, a lot more sensitive. So dilution is always recommended to start with, at least to see how their skin adapts to using some of the oils and what oils may be more suitable for them. Then the third way for using essential oils is internally. So internally is either adding an essential oil like a citrus oil into your water, into a veggie capsule if you're looking to detox, or just under your tongue. So if you're looking for some sleep support or for some digestive aids. And again, that's where internal use during pregnancy is not always recommended. And that's where always seek the guidance of a practitioner before you do start integrating new protocols into your daily regime. So what I want you to do is we're going to get started with Stephanie's presentation in a couple of minutes, but as she's going through her course, I want you to either write down or kind of take a mental note of the top health concerns. So your top 3 health concerns, either for yourself, or if you're a doula, a midwife, or a health practitioner, maybe write down what the top health concerns are that come into your clinic or you see on a regular basis, because this is where you can kind of take note and say, okay, these are some really good oils that are supportive for that. And that's where, here are just some examples, whether it's stress, tired, pain, and whether you're wanting more energy to feel happier or fitter. These are all things that we experience on a regular basis and are typically even more amplified throughout pregnancy. So that's where, take a look at that. And then these are my contact details. If I have been the one to send you a link or you've clicked on my link, send me your top 3. Otherwise, go ahead and send Stephanie your top 3 or anyone else that has guided you to this link and to enrolling and registering for this class. If you're not sure, you can always send it to myself or Stephanie and we'll direct it to the correct person. And that will basically be the person to guide you and connect with you after that. The next thing that I want to talk to you about quickly is there are going to be a couple bonuses. There's going to be a bonus that I will be offering where there'll be an incentive for a free essential oil that will be offered, as well as Stephanie will be sharing an extra bonus for her full course that she'll be offering as well. So that is available to everyone and anyone that might be interested in this. So definitely we'll give you guys more details on it as we get forward. So Stephanie, go ahead with your presentation. Thank you. So as you guys have questions, feel free to just type them in the chat box and I'll put out my email address. I'll put my email in the chat box as well. And it'll come up. You'll see my details, Stephanie's contact details, but feel free to message in the chat box and we'll kind of come back to that as we go. Are you able to share your screen, Stephanie, or is it? I think you're muted. Let me see.
Hi. Hi, everybody. Sorry about that. Thank you, Zarine, for that introduction and telling everyone a little bit of the basics of essential oils. I will be sharing my screen. I want to give my initial introduction without interruption of the screen behind me because I think it's hard to see people on Zoom, at least for me who wears glasses. So my name is Stephanie McBride, and I'm from Portland, Oregon. I have 3 kids who are now teenagers, and I got interested in maternity after years of working as a functional nutritionist and clinical herbalist and just finding myself really drawn to that demographic of people and wanting to know more about how to support people throughout maternity and with new babies and nursing. And I also worked a lot with young kids and autism. And when I first got interested in essential oils, it was when a friend turned me toward doterra for a couple different things, hip pain. We had a lice treatment we needed at home with young kids. And I was so impressed by their efficacy and how fast they worked. I just thought, wow, I've really got to learn more about how people that I'm working with for birth can use these during their labor and their pregnancies. And it took me a minute, like I'd kind of forgotten the experience because people forget things when they're in labor, but actually during my first childbirth, which is 18 years ago, I was in probably the hardest part of that labor, which was I'd been up for a night and a whole night and been laboring all day, and it was almost the next night, and I was just extremely tired. And it was right before I started the pushing or second phase of labor, and so I started vomiting, which some women do. And I just like could not think clearly. It was a lot of like fatigue and brain fog and nausea all mixed up with the labor pain, which makes it sound wonderful, but it's actually what I wanted. I wanted a natural childbirth, and I went in really hoping that I could have that. And I was lucky and could have that. I didn't have to have medical intervention. So not everyone can have the birth that they want. But in retrospect, I also didn't set myself up with any natural remedies for my labor or even during my pregnancy. I just went without, allopathic drug intervention, but I didn't bring anything else in. And I think that was a place where I made a mistake. And that's why I do this work, to like empower women to be able to bring alternatives into pregnancy and labor, and also integrate them with medical care when and if that's needed. So what happened in this phase is my midwife put a drop of peppermint essential oil in my vomit bucket. And I took a breath of it, and just like it changed my entire experience. It woke me up because it's great for that. Wakes your brain up, energizes your body. It stopped the nausea and also helped with labor pain. And that was just such a gift that I received from her. And like I said, I completely forgot about it until years later when I was thinking about my own experiences and about essential oils and how to integrate them. And I was just so moved to have this memory of what happened during my labor and how much it affected me in a positive way. So I wish I would have had a lot more of that. I went on to have 2 more kids without essential oils. And it's just such a wonderful thing to be able to bring into your pregnancy and your whole experience in the childbearing year, because it's a tough time in life. There's a lot of ups and downs, and some of them are emotional. There's a lot of physical discomforts. So anyway, I'm going to share my screen now. If you're watching this on my Facebook group, Essential Oils for the Birth Kit Live, you can go to events and jump on to see a link for the Zoom call, so you can actually see the screen I'm sharing. So can everybody see that on Zoom? I think so. Okay, cool. So first, before I begin, I want to say the content I'm providing here is for educational purposes and not intended to replace the advice of a physician. So these oils that we work with, especially when we're working with doTERRA or really high quality therapeutic grade essential oils, they're very potent and they can work like medicine. A lot of doctors are using these oils now in their medical practices. So they do have those strong effects and can push the physiology as medication could, albeit without the side effects and, with a lot of other positive side effects because they're so whole compared to like a drug. But that being said, you don't want to replace medicine with essential oils for things that you're not familiar with how to work with. So work within your scope of practice. If you're not a physician, don't make recommendations for medical problems with essential oils. There's so many other uses for them. So Again, this is me. My certifications include clinical herbalist, functional nutritionist, master aromatherapist in process, and I'm also a Reiki master teacher. And I just wanted to show this picture on the left because I have this like amazing background of herbal studies, you know, through going and wildcrafting herbs, and I've studied on 3 different continents and just love natural medicine. And so it's amazing to me that we can have it like captured in a little bottle and be so potent and easy to access in the essential oils that we use. Zarine did touch on this, but I want to relate what essential oils are to pregnancy. Basically, you can see on the right here, this is a close-up of the volatile oil in a peppermint plant. So you can see how that's a little sack of oil. So they're actually very chemically complex and fat-soluble, concentrated, volatile aromatic compounds. And to me, the reason this is important is, oops, sorry, see if I can get back to that. Okay, is because they are lipids, so they're fats, and they're very, very small molecularly. And this is why they can cross through biological barriers in the body, such as the cell membrane. So pictured here is a cell, and it shows the essential oils can pass through that phospholipid bilayer that is the cell membrane. And that's unique. Most drugs cannot do that. And you can see also from this picture that viruses live inside of cells, bacteria lives outside of cells. So there are a lot of other natural barriers that oils can cross. Some oils can cross the blood-brain barrier to affect things like fatigue and memory inside the brain. And others can cross things like bacteria. So superbugs, for example, when we're sick, can be penetrated by essential oils, whereas they're becoming more antibiotic resistant. Essential oils, some of them have this constituent called carvacrol, and that works like a screwdriver and actually taps through that outer peptide shell of the superbug, superbacteria. So you can think of it like an M&M with a hard casing, and essential oils can crack into that casing. There's a lot of other examples on how they can help us with viruses and bacterial infections, and there's so much research on this, and that's something that people can utilize during pregnancy if they want to have a natural approach to immune building and just protection from those kinds of microbes. So I guess I'm pointing that out because I want you to understand that they do cross the biological barriers in us to affect our cellular health and our body systems, but they also cross through the barriers in microorganisms and invasive things in the body, you know, fungus, bacteria, viruses. So that's an amazing attribute to have. And indeed, they do cross into the placenta. So we want to keep that in mind in pregnancy. The oils that I work with are not toxic, but we also, you know, there's not a lot of research. This is how much research has grown. And I'm sorry, I covered up with you guys, so I can't see the final year since your faces are over it. I usually would read it off. But just to get a look, and this is even, you know, 5 years old, but just to get a look at how much more research we have now and how much this is growing is pretty incredible. So I base my information off of about 2 years initially of just, I quit my clinic job and moved home and just studied full-time essential oils for maternity and childbearing. And so I've read every study and done a lot of like case studies and interviews with midwives and doctors. And, you know, that's how I've gotten my information for the large part. But, you know, there's not a lot of research for maternity because it's considered unethical to test on pregnant women, which makes sense. And that's true for essential oils too. So we do have some research. Everything that I have told you about in this class, like some of the things are based on tradition. We have a rich tradition of essential oil use of 5,000 years of use across the world. And also what I've learned from personal experience working with this group of people in my practice. So a few general safety guidelines. It's important to receive the mother's consent before using essential oils for her care. And only use essential oils when their uses fall within your scope of practice. So for example, if someone has a breast infection or mastitis, you could support them with essential oils because they're wonderful essential oils for that, but make sure that also there is a doctor caring for her. That's a serious condition. There's a lot of serious medical conditions that are sometimes handled really well with essential oils, but you still need to work with someone to keep an eye on them because they could, obviously progress. Also, use only high quality essential oils that have been grown and processed to maintain their purity and complex molecular structures. So as you saw, the oils are passing through the placenta, through the blood-brain barrier, deep into your body. They also go into breast milk. So it is really especially important in pregnancy that you're using very pure oils. And the point of using the complex molecular structures is so that you're actually getting the medicinal effects. So even if you have all natural lavender, if it's just produced for scent, you're not going to have the full benefit from that lavender. You may only have one or two of the attributes, or you may just have the scent alone, instead of having all the amazing cofactors from the different complexities of the plant and of the oil coming in to help with some kinds of therapeutic actions, if that makes sense. So I ask people to start with the lowest dose possible to achieve the desired effect. Usually for a massage during pregnancy, that's 1 or 2 drops per teaspoon or per 5 milliliters of a carrier oil. Now, you can go up from that. So the point is that you start diluting when you're getting used to the oils. And if you're already using oils and then you find out you're pregnant and you want to keep using them the way you've been using them, I would still suggest going back to this dilution and just checking and making sure that your body's handling the oils in the same way. And then you can build up from there. So if you find that that's not a strong enough dilution for massage or whatever else you're using them for, you can add more. Just go slowly, because sometimes people have skin reactions or negative effects when they're pregnant. You can also avoid prolonged exposure to any one oil. This, in a large part, is for their efficacy or how well they work. Your body gets used to something, it doesn't actually work as well. So if you're using them for sleep, for example, I love geranium for sleep, frankincense, there's a grounding blend by doterra called Balance, great for sleep and lock after using it. Body's like, what? I know what this is. I don't want to sleep. So change them around every week or two. And during pregnancy, some of the oils that have hormonal effects like fennel, for example, are best use for 1 week off as well, so that you don't, during pregnancy, just put the diluted oil on your arm. Or if you want to try the oils neat during pregnancy, also just put a little bit on your forearm or the top of your foot and just watch it to make sure that you're still able to use them at that strength. And do not use essential oils for internal use or oral use during pregnancy or infant care unless formulated for internal use and deemed safe by a reputable company or a physician. So I just like to stress some just sensibility that you may be used to shaking oils in your mouth and using them all the time before you're pregnant, but since we don't have a lot of research on their effects on the fetus and on the microbial environment during pregnancy, I think it's best to use ones that are pre-formulated. For example, doTERRA has some vitamins called LLV that I think are amazing during pregnancy. They do have essential oils in them, but then they're measured out. No one's going to be taking extra vitamins and going above what the recommended dose is. Let's see. With risk of miscarriage, refrain from using essential oils in the first trimester. In part, that's because sometimes they can be blamed for the miscarriage, even if it's not because of them, but it's just better to not interfere with your body if that's something that is a risk for you. And then keep all essential oils out of reach of children and avoid in the nose, ears, and eyes. Children getting a hold of bottles of essential oil and getting them in their eyes and all over their faces is one of the largest causes for harm from essential oils. So they are incredibly safe for children and even for babies. But if they're not kept away with the caps on tight, then, and they're misused, then yes, there can be irritations and complications from that. So I like that Zarine gave you an introduction to the different applications, and I'm just going to go into them in a little bit more detail so that you understand how to adapt these or things to be mindful of during the childbearing years. And then after I go through the applications, I'm going to talk about my favorite oils for pregnancy and how you would go about using them. And that kind of depends on what time allows. Now, if anyone has a question during this, I think Zarine can see the chat. Is that right?
Yeah, so I'm kind of answering some of the questions. I guess we can just a quick thing. Some people are saying that they're finding your audio is echoing. Is there anything that you can change? I don't know. Like, I'm not hearing any echo, but two people have said that they are hearing a little bit of an echo. Another question that came up was, how does one recognize high quality essential oils? Do you want to talk about that as well?
I actually took that slide out of my presentation, but if you don't mind me switching, let's see if I still have it open. I had a slide on that. No.
The whole point that I had mentioned was like the quality testing, the reports.
Yes, so well, actually on my website, Daily Nectar Essentials, I've written every criteria for quality on a page on my website under, I think it's called Shop Oils, but under that it'll say quality. So you can look there and it's all written out. But basically, there's a big difference if a company's trying to like produce an oil just for a lotion for scent or for a perfume as opposed to quality. And part of the issue starts with just where you source the oils. So you want to find a company who's sourcing them like either where they're native so that they have all the conditions in the environment kind of stimulating their chemistry to get the just highest levels of these medicinal constituents, or you want to also look at the processing. So some steam distillation processing is done at the wrong time during the plant's life cycle, or they cut corners in other ways to get the product out there faster or to have more of a quantity instead of quality. So there's a number of different tests. There's like 5 main tests that are done and 2 additional tests that are done for purity. So I would look for having a third party certify and test. That's what Zarine was talking about with therapeutic, certified therapeutic grade essential oils is what doTERRA has as a certification. And they actually created that standard, but it's because there was no standard. Like in the US, only 5% of what's in the bottle has to be pure to put pure on the label. And so there aren't a lot of regulations. I mean, it depends on which country you live in, but the reason doTERRA created that high standard and then hired a third party of chemists to check every batch of their oil that they met that standard themselves is because they wanted to elevate the expectation for what essential oils are and how they can be used. So you could also find a lot on doTERRA's website on quality. And I encourage people to look into sourcing as well, because there's a lot of inequity in international business. And these oils come from all over the world. And to me, it's really important that we're meeting the farmers' needs and having fair trade and equal processes there. And doTERRA has a lot to say on that topic as well. So I hope that helps. It does go in, there's a lot more detail on my website and on doTERRA's website, obviously. So I just want to talk a little bit about these different uses during pregnancy. So for aromatic use, we do diffuse oil and breathe out of our hands. And, even when you apply oils topically, like you get a massage, that's also having an aromatic effect. So keep in mind that if these overlap, especially topical and aromatic uses overlap. Taking a bath is not just aromatic and not just topical, it's both of them combined. But just to separate it out a little bit, if you're deciding when and how you should use your oils for different things, if you would like to affect your mood, your emotions, or your memory, or even your level of mental fatigue, for example, and clarity, then you can use them aromatically. That's really the best way to do that. You can also diffuse them for, or spray for airborne pathogens and to open sinus pathways. So the limbic system is this incredible system, and basically it's the primal seat of emotion in the brain. And I don't want to go into a lot of the science behind this right now, but I will say when you take an essential oil, and if you have one at home with you, just put a drop of it in your palm. And I want to recommend, if you're not a nursing mom, to put a drop of peppermint and a drop of frankincense in your hand, and then to cup it over your nose and take a huge inhale through your nose. of those two oils. And you can really feel those two together, how they make your brain more alert, they clear your sinuses, and they're also very grounding. Frankincense can cross through the blood-brain barrier because it has something called sesquiterpenes as one of its constituents. So I feel like it just brings the peppermint with it and wakes your brain up. So those two together immediately affect your emotions and your mental acuity and your energy. And I have this just short story to share. I was doing the medical tent at a festival outside of Eugene, if you guys know Eugene, Oregon. And this guy came in and he was really, I think, dehydrated. He had been, dancing all night, and I don't know what, probably drinking or doing drugs or something. He was this young, very thin man, and he was having kind of a panic attack and felt like he was going to pass out and was just really unstable. And immediately the managers of the tent called the medic. So medic team came in and we're taking his blood pressure and checking on him. And they finished up and said, we'll call you an ambulance. We can't help you here. And I just kind of peeked my head in the tent and I was like, is it okay if I offer some essential oils while he's waiting? And they said, sure. He said, sure. Yeah, I'd like to try some. So I went in there with peppermint and I just had him do what I told you to do. I had him put it in his palm and breathe. And he put his palms and, thank you. And just like exhaled this thank you, because it woke him up from whatever this funk he was in. It completely woke him up, energized him. He could think clearly. And then I said, I think you need a smoothie. I think you're dehydrated and your blood sugars crashed. And his friend got him a smoothie and literally he just was fine after that. And I don't think that solves every medical emergency, obviously, but it's, even if he had to go to the hospital for some serious medical condition, the peppermint is emotionally very grounding. And I'm going to talk more about peppermint. It's my favorite oil for pregnancy, but that happens so quickly when you inhale it. If there had been some kind of drug in the tent to help him, it would have taken time to take effect. That's how it is in most cases, unless maybe it's injected. But so these are really fast at dealing with emotions and meltdowns and even blood sugar balance and things like that. Peppermint's actually great for that as well. So another point on aromatic use. This is a study from Danielle Daniels on impure jasmine versus pure jasmine. Jasmine's one of the most adulterated oils or made synthetic oils on the market because it's so time consuming and expensive to produce. And a lot of people are just after the scent. So why not make it synthetic? But when you actually use real jasmine, like I would recommend doing during labor and postpartum, you're going to notice a big difference. So in her study, she found that the synthetic jasmine, when inhaled, created a stress response or a sympathetic response. So rapid heartbeat, more circulation flowing, just how you feel when you're stressed, muscle tension. And then as opposed to that, inhaling the pure therapeutic quality real jasmine had a not suppressed, but it lowered the it raised the parasympathetic nervous system, which is the opposite of fight or flight. It's rest and repair. So basically the impure caused a stress response and the pure caused a relaxation response. So I just want you to note that even when diffusing oils, the quality is really important. And at first I thought, oh, the quality doesn't matter with diffusing oils. It's just when it's on your skin or when you're eating them, but actually it's for everything. So some uses during the childbearing year and even just parenting or childhood are for stress, quality of sleep, mood, feelings of anxiousness, postpartum hormonal balance, postpartum blues, fussiness, sinus discomfort, and air purification. And this is some digestive blends. So they can also help. I didn't list this on one of the uses, but aromatic use can also help with digestive support. So sometimes I like to make blends like the ones listed here and then actually apply them topically and smell them. So almost every time I'm applying oils topically, I'm also taking a moment to inhale them before I apply them or to breathe them off my hands after I apply them. I think that can just enhance the benefit and diversify the benefit. So these are just a few that I like. I mean, the seed oils are great for digestion. Citrus oils are great for digestion, the mints. And here are some oils that I like for inhalation during labor pain. Lavender, frankincense, geranium, Roman chamomile, clary sage, white fir, black pepper, peppermint, and I especially like the last three for back labor pain because those ones are so penetrating. I wish I could see your faces, but I don't know if any of you have back labor pain. Oh my gosh, I had it for all three of my babies and it's really intense. And I didn't have the oils then, unfortunately, but I just used hot and cold compress to treat that naturally. And I'm just like swoon over, oh my gosh, if I would have just had like lavender and black pepper, on my cloth, like that would have helped so much. So I think those are amazing for labor pain topically, but then also you can inhale them off a handkerchief. Another labor pain blend is clary sage, lavender, and rose. And you can just put those three. You don't have to put them in a carrier oil and apply them topically or put them in a compress. You can just put them on a handkerchief. So I often recommend to women that they bring a like special handkerchief to the labor. And that helps if you're in a hospital birth, or even if you're in the room, like if you're diffusing lavender or something like that, which does help with labor pain, but you have this team of birth professionals and maybe your partner in there helping you, like you don't want them to fall asleep. So another point of having it off the hanky is that you're just inhaling what you need when you need it, and it's not all over the room. And then obviously if you're in a hospital or birth center, it's just something that could get away with, like there's restrictions sometimes about scent, or maybe you'll get a comment from the staff not to diffuse. So think about doing it that way. So on to topical uses. So these oils penetrate the skin, the muscles, the cell membranes, sometimes the blood-brain barrier, as I've mentioned. And when you use them topically, I feel like they have the strongest effect on physiology. So how your organ systems work, how your body works, like the flow, your circulation, your lymphatic flow, your skin health, they have more of a generalized effect, and aromatic qualities are also present for most of these applications. So some of you may have seen this before. These are red blood cells taken from using dark field microscopy and presented by Dr. David Hill in Utah in 2009. And this was actually a video. I have two stills here from the video. But basically he ate something really unhealthy so that he would get some oxidative stress right away in his blood. And then this is 30 seconds after he put a drop of Balance essential oil on the bottom of his feet. Balance is our grounding blend by doTERRA, and one that's really nice during labor. And it was applied to the bottom of the feet. And I like that application because the skin is tougher. So if there's oils that are stronger that may be a little bit more harsh, like marjoram, for example, during pregnancies, when I recommend for immunity, like that can be a little bit more sensitizing to the skin. So the bottom of your feet are tougher, but also they absorb things so much more quickly. So this is like 30 seconds after applying one drop in his finger, how this affected his blood. So just know that that's a good way to use them. The pores on your feet are big. And also for babies, like I love having a bottle of diluted oil on the changing table and rubbing it into the bottom of the baby's feet when there's when there's things going on that you need essential oils for. And here's an example of how they can help used on the skin for wound healing. And a really good trio of oils is melaleuca, lavender, and frankincense. And I think that might also say, does that say helichrysum last? I can't see what's under the slide by frankincense, but no, okay. I also like helichrysum. It's a little bit more expensive, so I don't always put it in the blends. But so this is just a wound spray, and you could use this postpartum on the perineum to heal tissues, or if there's a cesarean section needed, and even like for naval care, like you just want to make sure if you're using a spray that you dry it off after, let it absorb for a few minutes, and then dry it off. Especially if you're doing cord care for a baby, you don't want moisture in there. You can also, for cord care, add these same oils to like a waxy salve type of thing. And you'd want very little of it that you actually use on there, but it's helpful for healing. So that little boy had stepped in some kind of acid in the street and used those oils, sprayed on, and this is 15 days later. So it's pretty amazing. I've seen actually a lot of before and after photos like this, and it's incredible how much faster you can heal your tissues. And certainly even if you don't tear during pregnancy when you're delivering, or need an episiotomy or anything like that, you can still see that your tissues need to be healed. So a lot of people will use those oils in a sitz bath also, just to like help with tissue recovery. So, and speaking of episiotomy, since there's so few studies on essential oils during pregnancy and postpartum, this study just shows that lavender was used instead of povidone iodine to treat the wounds of an episiotomy. And it actually showed it was significantly better at, I think it was inflammation that was the big difference, redness and inflammation. But lavender is amazing for wounds because it's a natural antiseptic, and it also helps the pain, and it's good for inflammation, and it helps obviously with calming. So like for my kids, they still skin their knees, but my youngest is 12, so I don't keep this around as much, but I would make it in the moment. Like, so when they came in skinning their knees, or if we went camping, I always had a 1 ounce bottle. And I just would put the water in it. And then if something happened, I would have my bottle of lavender and add like 15 drops to the ounce of lavender and shake it up and have it there in the moment, ready to go as a wound spray. I've also just dropped it directly into their wounds before. And they say it doesn't really sting. I've done it to myself. It doesn't even really sting, but it has all these incredible effects. So examples of topical use that you might need during maternity include baths, foot baths, and that's a great option if someone's planning a water birth, because it's better not to put the essential oils directly into a water birth tub. And I'm just going to deviate here to explain that because I know some people might want to know. In part, that's because those tubs are usually lined with plastic, and the oils can leach toxins from plastic. And if your baby's going to be born into the tub, we don't want that. And also, oftentimes it's just done incorrectly, and there's like drops shaken onto the top of a tub, and that could get into the baby's eyes. Often babies will open their eyes when they're born underwater. And then just any kind of atopical reaction. I had a midwife friend of mine tell me she put birch essential oil, which is really strong, it's kind of like wintergreen, into a birth tub. And when the baby was born, they had bright red like skin. They had this huge reaction to it. So just be aware, it's better to do massage with oils that absorb into the skin pretty quickly. I know that like the carrier oil doesn't absorb that quickly into the skin, but the essential oil part will usually absorb in about 10 minutes when you get a massage. So you could do a massage and then get into the tub 10 minutes later, and most of the essential oils in your body. Also doing a foot bath obviously just keeps, gives you the effects, but then it keeps the essential oils out of the birth tub. A labor tub is a totally different story. If the baby's not going to be born into the tub and you have a labor tub, that's great. Go for it with oils. You can also use these in sprays, lotions, ointments. So there's some really nice natural ointments for things like nipple cream or ointment for cracked nipples and things that, like, I would just put a little bit on your finger and then add a drop of essential oil to something that's already made. If you don't want to make everything yourself, you can certainly do that. Roller bottles are nice. I use them usually about the 10 milliliter size. And I would put, if it's a gentle oil like lavender, I would do half lavender and half carrier oil. And if it's a little bit harsher of an oil, like maybe you're doing a digestive blend with some seed oils and citrus oils, I would do like a third of the bottle and then of essential oil and 2/3 carrier oil for pregnancy. Compresses are also really nice. I'd mentioned compress during labor. They can also be used in postpartum. A couple examples of that during labor. If you guys know what a crock pot is, I know this is an international group, but it's just one of those pots, ceramic pots that you plug in to make your soup ahead of time for the family. But you can take those to a birth and then just have rags or cloth in that with water and essential oils so that you can use like a hot compress on the back or front during labor for pain. But they can also be used for postpartum healing. So I talked about perineal and tissue healing, or even like cesarean section healing. What I like to do for those things is I have some glass bowls, and I'll just mix essential oils with a cloth. And I am going to give you guys a PDF. If you signed up for this class on Eventbrite, or if you're watching on Facebook, just make sure to ask me if you don't get the handout by email. But you should get a handout that has all the concentrations I'm talking about, so I don't have to keep interrupting myself and tell you what they are. But anyway, so for a compress that's frozen, you'll just want to basically mix water and the essential oils you'll be using. Usually I use something like geranium, and then put the water and the cloth in the freezer, basically absorb all the water with the oil into the cloth, and then put it in the glass container and freeze it. I just, again, avoid plastic there. But then you can take that and you can use that as a pad in your underwear just for healing, and then just make sure that you're dry when you get dressed again. But it can be a really nice treatment for that or any kind of other wound. And then also massage is, of course, the way most people would think of for using these oils topically. And here are a few prenatal massage blends that I like. Notice that each of them have relaxing essential oils as well as more penetrating. So the peppermint is really penetrating, while lavender, sandalwood, and orange are more of the relaxing oils. And then on the second one, cypress is more penetrating. So I like these oils to drive more deeply into the body, especially if there's issues with sciatica or joint pain. So I say sometimes, in case you want to know a little bit deeper into how these oils work for pain, a lot of it is that essential oils help to reduce stress and tension, and having high stress and tension can increase the perception of pain. So, and this is true for any kind of pain. So if you have, labor pain, or if you have trouble with back pain, stuff like that, you want to keep in mind that those relaxing oils and stress reduction is really going to help to lower the perception of pain. So that's why I have lavender in both of those blends, and Roman chamomile, sandalwood. But then there's other oils that work more through pathways in the brain. And one of those is ginger. We haven't tested all the oils for this, but I suspect that peppermint works like that too, and cypress works like that too. But there's not conclusive evidence on that, but basically ginger has the most research that that's how they work, through interrupting pain receptors in the brain. So I like to come about pain from both of those angles, because why not, right? So my blends keep that in mind. So I wanted to talk a few minutes about safety precautions for infants, because they're our most vulnerable people in the population, and we want to make sure if we're going to be recommending oils to people with babies, that we really know how to use them with babies and don't cause any harm. So again, avoid contact with the mouth, eyes, nose, and ears. And I don't think I mentioned this later, but that includes, if you're using them for nursing, apply the oils after the baby nurses, so that you're not then setting the head of the baby next to you where the oils have been, and risking getting, their skin is so sensitive. It's very thin and immature when they're born. Their livers are not fully developed. So we just don't want to put oils on their faces. So you can apply them after you nurse, and then wipe off what's left before you nurse with a warm, wet rag. Sometimes you don't need to do that. If it has, 20 minutes to be absorbed, it shouldn't be a problem. Do not use internally for babies. They should start using them when they're older, like toddlers, if you're going to use them internally. Always dilute oils with a carrier oil for infants and babies. I know it's usually about 1 drop per tablespoon, but that's more of a massage blend, and that's 1 drop per 15 milliliters if you don't know tablespoons. And so that's kind of an all over infant massage. So if a baby has colic or diaper rash or something, that would be the concentration you'd use. If it's something like cord care, it would probably be a bit more concentrated, because you're using such a tiny amount of it. But I think that it's way less than you would use for an adult. So it's usually about 1 drop. It could be as much as 2 drops per tablespoon, like I said, for cord care or something, but it won't be ever just using the oils neat on the baby. Test oils on the skin and check for irritation 2 to 12 hours before use. Use for general wellness only. Consult a physician for medical issues, or use them alongside of a physician's care. Use a teaspoon of an emulsifier, such as liquid soap in baths. So I mentioned earlier, like if you just shake the oils out onto the top of the bath, then they don't really work. They just sit there on top of the bath, and you risk interaction with the oils on the skin directly, or in the baby's face or something. And you really get more benefit from mixing the oils in. I'd like to do a Cleopatra bath, which is about a half or a quarter cup of heavy cream, like, or half and half. So I mean like the cream you drink. With essential oils I use for myself, I use like 6 to 8 drops as just an adult in the bath. And I fill the tub first and then add all the oils. And so for a baby's bath too, you just want to make sure that you're mixing it with, like, glycerin would be really good, or you can use salts, but I prefer something like liquid silver glycerin for babies. And then just mix the oils, even in your hand, just pour it in your hand with the drop, and then mix it in the water. Make sure it's all mixed around in the water before you put the baby in, or something like that. And if you use a spray bottle, either use an emulsifier or shake it every time. Just be careful about that. So also keep out of reach of children to avoid accidental topical and internal use. I already mentioned that's the #1 cause of harm. And avoid using the top photosynthesizing oils with sun exposure. So the most photosynthesizing oil that we have is bergamot. Lemon is another big one, grapefruit, orange lesser so for the citrus oils, but in general, you can remember maybe doing what I did, which was putting sun in my hair as a kid to make it more blonde, or my mom used to put lemon in her hair to make it blonde. So like citrus does bleach things out and attract the sun. So just be careful not to be putting like bergamot on your chest or on your stomach and then going out in a bikini in the sun. You'll get very burnt. And during pregnancy, the melanocytic hormone is actually elevated. So women are more sensitive to photosynthesizing essential oils during pregnancy than they are at other times of life. So be especially careful for that. There's also a blend that doTERRA makes called Clary Calm that has bergamot in it. And I've heard of women in postpartum using that oil. It's great for postpartum, but like getting really sunburnt also in postpartum. So just know that the hormones are a little bit different, and that is a really photosensitizing oil. Also, I wanted to mention that when I talk about starting with heavier dilutions, it is more because of the skin reactions that people can have during pregnancy. So your liver just isn't functioning in the same way that it normally would be. And it slows things down, and that can cause more skin sensitivity. So basically, if you're used to putting oils just straight, or neat on your body, that's why we say, no, dilute them during pregnancy, or at least start out that way and see how your body responds. That brings us into dilutions. So these are all in teaspoons and tablespoons, but the chart that I'll be sending is in milliliters, because I think that we have a mixed group here, but basically during pregnancy, it's 1 to 2% or 1 to 2 drops per teaspoon or 5 milliliters. And then that just kind of changes over time. I don't have labor written there, but with labor, you can go up like a lot more than that, because this is a really intense time. And a lot of times people need a little bit of a stronger blend or a stronger set of essential oils. So for labor, I usually start at 3% or 3 drops per teaspoon, but if it's not effective, then add more essential oil. You just don't want to have skin sensitivity. And then I have a couple other ratios here for baths. Like a labor bath would be 4 to 8 drops. Again, that's not in the birth tub. So those are some basic recommendations. This is not an exact science. I mean, it is in a lot of ways, but as far as concentrations and dosage goes, it's so individual, because our constitutions are different and we handle the oils differently, and there's different levels of thickness with skin and qualities of skin, and that changes with age and race, and there's just so many factors. I know, like I take oils orally now, but when I first started using doTERRA and my friend put some drops of oils in my tea, it was really strong for me. And I realized after the fact, like I just was still working on detoxifying and it wasn't ready for it. So I think people handle these all differently, and you need to start slow no matter what time you are in life. Like if you're not pregnant even, and you're starting new with using essential oils internally or topically, then you would want to start more diluted and then build up and see what your body likes. So here are some indications for topical use during the childbearing year. Muscle pain and tension is really common. Leg cramps, hormones, hemorrhoids, hormones too, swelling, digestive upset, headaches, labor pain, labor progression, tissue support, wound healing, breastfeeding support, colic, diaper rash, and teething. And there's a lot of different oils you can choose for each of these things. So I have a couple books written on this topic. I have a spreadsheet. I have a tear pad. And also my website, dailynectaressentials.com, has a whole list of my favorite oils for different phases of pregnancy. You can click in and read about how to use them all. But I just wanted to have this be like kind of a general overview of how to adapt use for pregnancy. So when I talk about my favorite oils, I will be talking about more indications of what they're good for. So for internal uses, I don't highly recommend these during pregnancy. I do, however, like when people have something pre-formulated and they're taking a finite amount of it. For example, the vitamins I'd mentioned earlier that doTERRA makes, those have been tested with pregnant women and they've been used for many years, and I feel very confident that those are safe. So I think it just depends on the situation. I guess I don't recommend internal use because a lot of people are self-medicating and they just shake the oils into their mouths. And I think there can be sometimes there can be repercussions from that and we don't know what they are. Like, I think, for example, taking a lot of peppermint, that's an emmenagogue. So you may not know if you're pregnant or not, but if you're taking a lot of peppermint beadlets and it's an emmenagogue, that does bring on your menses. Now that doesn't mean it causes an abortion, but it's kind of one of those fine line, like if you go to a doctor and you've had a miscarriage, I said abortion because in herbalism we call peppermint, or we call oils that cause an abortion abortifacients. So I actually meant just miscarriage there, but I'm used to talking like an herbalist. Anyway, I guess I'm just saying that we don't have enough research to justify people self-dosing internally during pregnancy. I just don't feel safe saying, go for it, have whatever you want. I think that doTERRA oils are very safe. And if I were teaching more of like a medical group right now, I would have a bunch of slides up to show you studies on internal use and how safe it is. However, none of the research is on pregnancy. So I'm waiting for that. I hope that we'll get some research on that, and then I'll just give everyone the green light to go for it. But right now, I don't like to speak about things that I don't have the background to speak on or the information. So hopefully we'll come up with more of that. But at this point, I wouldn't worry about foods flavored with essential oils. For example, if you go to a party and someone put lemon in the hummus and you're pregnant, I wouldn't worry about stuff like that. I just wouldn't take tons of like essential oils internally when you're pregnant without talking to a professional. Oh, here's one of the studies. I didn't actually mean to leave this in, but there's a couple studies here that you can screenshot if you're interested in, but basically showing how effective essential oils can be when used orally. But this, again, not during pregnancy. Okay, so now we're going to get into my top essential oils for pregnancy. But before we do that, I want to just name a few I would avoid during pregnancy for various reasons. And let's see, that's basil, birch, cassia, cinnamon, fennel, oregano, rosemary, thyme, and wintergreen. Fennel is actually okay. I just wouldn't take it internally, which I'm already recommending not to do. There's a lot of different oils you can plug in and substitute for these. They're just not the best fit for the condition of pregnancy. And here's how I describe it. Like, I'm an herbalist. Like, I have over 25 years of experience studying herbalism, and it's sort of like Ayurvedic or Chinese medicine, the school of herbalism I come from. It's called Western Eclectic, but it's basically what it means is matching someone's constitution to which herbs are best for their constitution in that time of their life. And with pregnancy, we can make some assumptions because it's a condition that has a lot of similarities between women. So for example, a lot of women get hot during pregnancy. So I think of it as more of a hot condition. So if I'm recommending oils that are warming, I'll definitely mix them with cooling oils because I don't want to overheat the like 80% of women that feel too hot when they're pregnant. So I hope that makes sense. So I'd mentioned the photosensitizing oils. There's a list of them there. So that's something that's different about these oils during pregnancy that you should make note of. Also, some oils stimulate the cardiac system, or they like increase circulation. And a lot of these can be helpful during life, but during pregnancy, when your blood volume is nearly doubled, it's best not to be messing around with increasing circulation. So those oils include cinnamon, clove, and cassia. And especially just, you know, see how you feel during pregnancy. I know that those are in the blend On Guard, and people love On Guard. I would just see how you feel, because some women get sort of lightheaded and have issues with iron being low in their blood. So I think we just try to lay out, take iron-rich foods and take care of yourself with your circulation instead of overstimulating it.
One question that came up is, can you use the toothpaste from doTERRA, the On Guard toothpaste?
You know, I think that's fine. I think in general, what I talk to a lot of people at once, and I reach a large audience, especially with my books, and people watch my webinars after I've done them. And so I don't know who I'm talking to. Like if I were talking to an individual and all they were doing was brushing their teeth or washing their hands, I'd be like, great. I just don't know who's using On Guard, diffusing it every single day and having it all the time. So it's more of a matter of use moderation with the things I'm talking about here. And these are things even in the back of Modern Essentials, which is a lot of people that follow doTERRA and use doTERRA have that book. In the back cover, the oils I'm talking about are high precaution for all of these oils I'm talking about. So I'm just trying to explain why. Why does it say high precaution for those oils? And how to adapt use. So yes, I think it's okay to use the toothpaste and even the hand soap. I just wouldn't put yourself in an environment with the oils I'm talking about all the time. And I would just use caution. I would only use them when necessary for the most part. So some oils are also uterine stimulants and can cause contractions, which is great sometimes when you're in labor. But I think these are best to avoid until your body is totally ready for labor to begin, or you're actually in labor. And these are clary sage, jasmine, and myrrh. And you can add rose to the list. Rose and jasmine to me are not as strong as clary sage. I'll get more into clary sage when I go over the oils. The internal use of hormone influencing essential oils can affect hormonal balance. Again, why mess with that during pregnancy? It's kind of a delicate process. And as I've said, these oils are so potent, they're amazing. And their purity and potency makes them really effective and fast acting, but they can also push the physiology pretty strongly. They can also be used like drugs because of that. So just be careful. You wouldn't want to be using fennel every day during pregnancy because it has a hormonal effect, which is why I said, yeah, if you're using fennel for digestion during pregnancy topically, do 1 week on and then do something else for the next week. We just don't want to overwhelm the system. But that being said, most of these are very balancing in nature rather than being really strong one way or the other. Okay, so and peppermint may decrease breast milk production. Spearmint may as well. There's never been a formal study done on this, unfortunately. But Robert Tisserand, who wrote the book on essential oils safety, has a Facebook group, and he asked his very large Facebook group what their experience with peppermint was during pregnancy. And about 50% said that it did decrease milk production. So if you love peppermint and you're nursing, you could try it and just see, did that lower milk production? I wouldn't try it with a newborn baby. I would try it with a baby who's pretty established that could miss a meal, or that you could bring in a boosting oil like fennel and try to then increase the milk if it decreases. I would add spearmint to that. And I also didn't put on here that wintergreen and birch are they act like aspirin in the blood thinning quality. So those are best to limit or use caution with. Okay, so that's the end of the precautions. Now, most essential oils are appropriate for pregnancy. There's a lot more that are safe than that I would use caution with. So this is a list of some of my favorite. If I were putting together a kit, not just for pregnancy, but for infant care, it would include these oils. And that's black pepper, cardamom, cedarwood, coriander, cypress, ginger, grapefruit, helichrysum, lemon, melissa, orange, rose, spearmint, white or Siberian fir, and ylang ylang. And if you're just watching on Facebook, or you didn't catch all those on Zoom, like we will have a recording out of this as well. So, and they're also on my website with the top oils. My favorite oil in the world is peppermint. I love peppermint. And one of the reasons I like it for pregnancy is just because of the plant itself, and the structure. Like if you look at the peppermint plant, okay, it has a square stem and it has opposite leaves going this way and then perpendicularly going that way. So it's just very balanced. It's like, you can look at like a chair, like a really strong, steady chair, but it's also, like herbal foliage. Like it's not a woody plant. Your dog or cat can walk through it or lie down on it, and it often will come back up and be fine. Like it gets rain on and then pops back up. So it's flexible and mutable at the same time as being really firmly grounded in the ground. And I think that that's really what we need during childbearing and during raising young kids. I think those qualities are all amazing to have as a parent and giving birth. So that being said, it's good for almost every issue that comes up during pregnancy, including like morning sickness, vomiting, indigestion, constipation, gas, diarrhea, racing heart, sinus congestion, allergies, headaches, hot flashes, infections, muscular and labor pain, and it also facilitates contractions. Also, some people have said that they can turn babies with peppermint, because babies, this is just sort of, like incidental evidence, but I have heard this work for people. Like if you have a breech position baby, they move away from the smell. So if you put the oils on top of the belly when you have a breech baby, you could get it to be like, whoa, that's intense, I'm going to turn around. It also helps with fainting, confusion, dizziness, like the guy at the herbal or the festival I was at, fatigue, brain fog, shock, hysteria, convulsions, vertigo, transition stage of labor. I wish I would have had this for that. Transition phase is between active labor and the pushing phase of labor. So when you're fully dilated and you're getting ready to push, but you're moving from, that dilating phase to the pushing phase, a lot of women are just like, I was just like, I just cut the baby out of me. I'm done. I'm just take me into the OR and get it out. Like I just was ready to give up. And a lot of people are like, I don't want to have the baby right now, or I can't do it. I mean, there's just a lot of kind of fear during this time and unsettledness, and peppermint's amazing to just bring you back into the room, make you present, ground you, really good. I would definitely have this in the labor room for that and for the nausea during labor. It can help you overcome negative thinking and cope with intense emotions. So it's best to avoid in conjunction with homeopathic remedies. And this is just like women, like people with epilepsy or cardiac compromise as well. Better not to put in the baths and avoid in noses. I told the story yesterday, like it's better not to put peppermint and eucalyptus and things like that on a baby's chest, or even a kid under 2. Like it's really intense. If you haven't tried that yourself, like put it on your own chest. And also your organs are fully developed and theirs aren't, and your skin is fully developed and theirs is very thin. So for elderly people and people under 2, don't use peppermint on the chest directly. You can diffuse it. And then some misguided poor mamas have like injected peppermint and eucalyptus up the noses of their congested babies, and like that's very serious. They've had to get rushed to the hospital and like their breathing managed. They didn't die from it, but it's happened several times. So please, if you're an educator, pass that on to the people you teach about infant care. So another favorite oil of mine is geranium, and this oil is what brought me back from about 10 years of chronic fatigue. So I tell this story a lot. Maybe you've heard me say it before if you listen to me, but basically when my daughter was born, I mean, first of all, I didn't gain very much weight. I think I gained like 21 pounds during her pregnancy. I was really tiny. And I had a really long labor, natural birth, which probably should have, as my grandma always said, like, you should have had medical intervention or essential oils. I should have had clary sage is what I should have had. But I had a very long labor and I was up 2 nights in a row, and then I tore badly, and it just took everything out of me. I mean, I couldn't lower my arms after birth. I had so much stress hormone running through my body. I didn't sleep for 3 nights. I didn't sleep for like 5 nights in a row. It was absolutely the hardest time of my life. It was really, really awful, the sleep deprivation. I'd never had insomnia before. So this won't happen to you, don't worry, because you can have clary sage to speed up your labor. And oils, you have the oils. I didn't have the oils. But anyway, this carried on for years, this insomnia, where I'd have 3 nights in a row of 0 sleep. It was just awful. And 10 years after the fact, like I still suffered from a lot of aches and pains. I had to be on a really strict diet, gluten-free diet. Like I just wasn't in great health until I got into doterra, and my kids had lice, and my friend gave me a lice blend that had geranium in it. It was, it's posted in my Facebook group. If you search lice essential oils for the birth kit, this recipe is great. But I put this on my head with the shower cap, you know, with the other oils, and I slept more deeply that night than I had in like 10 years. It was like a dream and a dream. I'd forgotten that that's how you're supposed to sleep. It was just amazing. So I did it again the next night for the lice, and then I just kept doing it. I didn't do the whole, like once I figured out it was probably the geranium and the lavender, I just started to use that on my head at night for sleep without the bonnet. But what happened then was for like 6 months, I just had the best sleep I'd had in years. And I realized that my problem was sleep debt. People when they have babies, they don't sleep well for a while. And if you get sleep debt, it's really hard to recover. And what geranium does is it lowers your cortisol levels. So when you use it at night, it lowers your like stress hormone levels, but it also preserves them for the next day. So you have more energy the next day. Anyway, this is like saved my life. It's why I got on this career path, and it's like my second favorite oil. It should be my favorite, but anyway, it's lovely. And I'll tell you a little bit about it. It's very astringent. So that means it's tightening and tonifying to the skin. It's good at healing tissues. So things that are astringent are good at healing tissues. It's a circulatory herb. It supports swelling during pregnancy, the regulation of body fluids after delivery. It's good for good quality sleep in pregnancy and postpartum. It can be used for almost every symptom having to do with breast health. So nursing moms is a great gift for you to give yourselves, or for you guys to give to a nursing mom, because, oops, someone's calling me. Hopefully, okay. So it can be used for breast tenderness, milk regulation, engorgement, sore nipples, and breast infection alongside medical advice. Emotionally, it's calming, uplifting, sedative. It provides mental clarity and helps cope with stress and postpartum blues. So the only precaution here is to avoid astringent or tightening oils with elevated blood pressure, perhaps with a history of estrogen-dependent cancer, although some of these oils for which it says that are actually helpful for estrogen-dependent cancer. It's just that they have an effect. So I guess just check into that if that's your situation. But so the idea with elevated blood pressure is a lot of people with elevated blood pressure, their body needs to put that extra pressure somewhere. So they get swollen ankles and feet and stuff like that, but it's a way of relieving the heart. So if you're going to use astringent oils and you have gestational diabetes or problems with your blood pressure, then you're actually tightening a place where you should be you should be dealing with the problem with the heart instead of tightening an area where your body is regulating itself, if that makes sense. So lavender is another amazing oil. It's very beloved, versatile. Its primary use is for conditions involving the skin or tissues during pregnancy, and also to support infections, pain, nervous system imbalances, poor digestion, scars, insect bites, bruises. This is so good for kids. Like, just keep it in your purse or diaper bag. Eczema or dry skin, scalds, burns. This essential oils were discovered for therapy because of lavender helping with a chemical burn in an essential oil distillation plant. Anyway, it's really a good one to have in the kitchen also for that kind of burn, sores, pimples, postpartum healing, wound healing, also just any kind of pain. And again, this one works by lowering the levels of stress and tension, which are linked to lowering the experience of pain. So it's also good after the baby's born. People will have cramps and after pain, and lavender is a good one to use on the abdomen at that time to either do like a gentle a compress or like a gentle rub of the oil in, unless, you know, some practitioners know abdominal massage or Mayan abdominal massage that's appropriate during that time, and lavender would be a great thing to use for that. It's also good for lots of digestive things like constipation, colic, vomiting, gas, intestinal and uterine cramps. And it's good, of course, for all these emotional things: stress, poor sleep, tension, low mood. It's good for communication. So it's an oil you can put on your throat if you have trouble expressing yourself. And really good for kids too. If you have the kind of kid that like doesn't know how to express themselves and gets really frustrated, which before they can talk, most of them do, lavender can be kind of calming and help, especially applied to the throat. So keep that one around. Definitely have it for pregnancy and labor and stuff like that, and for kids. So just pay attention to the species names, because right here I'm talking about Lavandula augustifolia, and they vary between species, and some are not indicated for pregnancy or for use at all. Use special care with people with hay fever. People can have a true allergy to lavender essential oil. A lot of people are allergic to synthetic scents and synthetic essential oils. So you hear that a lot, but like lavender and a couple of their flowers, people can actually have true allergies to. Let's see. So I say here caution with induction of labor because it can affect uterine tone. A lot of people use it for induction alongside geranium and clary sage. But I would say I probably wouldn't use it alone. If you're trying to get your labor to start, I wouldn't be doing lavender massage every night. I would be doing more like geranium, clary sage massage every night. And then be careful about the fact that diffusing this around your birth professional team and your partner during labor can cause them to be sleepy. I'm not sure how we're doing on time. Zarine?
We're okay. We're about an hour, 15 minutes, but we can keep going. There was one question that had come up earlier that we can kind of address for nausea. I think there was an oil that you had mentioned for nausea for first trimester. So are there any oils that you would recommend that would be safe for them to use, and how should they be using them?
Sure, there's so many. I mean, from cardamom to all the citrus oils to peppermint and spearmint, even frankincense is on the list, lavender's on the list. So, you know, try to find the best fit. If people, like a lot of times people think scents are really harsh when they're pregnant. So sometimes people like spearmint because it's more gentle than peppermint. And you can use these like behind your ears, or I like to have like, there's these, what are they called? Atomizers, where you open it up and there's like a little cloth. You can get these. Do you have one with you? Maybe she'll show you. Those are good to smell out of. If you don't have a diffuser, you can have a warm bowl of water and put the oils in. Yeah, actually, Zarine, I have to go get my phone charger because I'm doing Facebook Live and it's going to cut my phone off. So would you mind showing people how to use that for a minute, and I'll be right back? You're on mute.
Yeah, I'll do that.
Thank you. Sorry, guys.
All right. Okay, guys. All right, so if you guys can all see my screen, these are basically the atomizers. So this is a really nice one where it has like dual sides, where it has like a roll-on on one side, and then it has like an atomizer on the other side, which is basically just a spray. And that's where you can still use like fractionated coconut oil. You can put in an alcohol base. You can do an aloe vera or like a witch hazel instead, as well as these ones come as like nicer, it has like the glass inside here, and then it kind of gets protected by the case outside. So it's really pretty, but that's where you basically make your own blends, and then you're able to atomize it very nicely as like a perfume or as like a scent to basically be able to spray into the air. And that's where it's like really beneficial. And these are ones where you can easily carry them in your purses, as well as they're very affordable, and you can refill them as needed, as you want them.
Okay. Thank you. Sorry about that. Oops. I got a new laptop and it has a different kind of outlet for it. So if you don't have the connection right, I don't get to charge my phone. Okay, am I still?
No,
okay,
I took off your screen sharing. Yeah, so go ahead and restart that.
Okay, where did it go? It seems to have disappeared.
It's not at the bottom of the main screen.
No, I don't know why it must have closed or something.
I think if you might have to minimize your screen to see it come back, or minimize your presentation.
Oh, okay, gotcha. Okay, I found it. Sorry, everybody.
Again, if anyone has any other questions, feel free to put them in the chat box and we'll go through them.
Okay, so I'm just talking about a couple more oils here and then I'll wrap things up. Thanks for sharing about the atomizers. I wanted to add about oils for nausea. Usually I don't recommend doing a blend. Like if you use one oil at a time when people are nauseous, it's a little bit more simple and not as overwhelming, but it's kind of personal choice. So black pepper I've mentioned a few times in this talk, and pink pepper is another option. They're pretty similar, but I've talked more about black pepper in the past, so I'll carry on with that. So this oil is something that offers pain relief by dilating the blood vessels, and it also has the ability to penetrate deeply into the nerves and muscles. So really good for things like relieving sore and tired muscles, supporting poor circulation, aiding nerve pain and back labor pain, sciatica. It's also, when I think of all the time for digestive problems, a lot of these ones that are also culinary are good for digestion, and problems like gas, diarrhea, constipation. They can help with cramps and uterine spasms. This one is really good to mix with other oils. It's kind of intense on its own, and it's also really strong. It can be more sensitizing than other essential oils, especially if it's not kept from oxidizing. So basically keep it out of the heat and keep it in a dark bottle and, you know, take care of it. Aromatically, it helps to enhance mental clarity and can give you stamina during periods of fatigue, such as active labor and just parenting in general. And it can be helpful for breaking the cigarette addiction. Emotionally, it's warming. I wish I put this chart in there, but I have a really cool chart that shows it's a thermo photography of the human body during different emotions. And it's really incredible. Like it shows anger and jealousy and resentment and fear. And anyway, and it shows where the heat is in your body or where you're cold. But during depression, the body's very cold. And so a lot of these warming oils will be very helpful if you're feeling down. And I know a lot of people can go up and down a lot during pregnancy, even though it's a warming condition, as I've said earlier, for most people, if you're someone with a really low mood, that it might be good to bring some of these warming oils in. Even if you're mixing them with something like lavender is very cooling, so black pepper, lavender together would be really nice. And it also inspires courage. So try not to use this oil undiluted, and if you're going to do that, I would test it on the back of the hand first, but in general, I would definitely dilute this and then mix it with something else. And this is one of the ones to avoid with homeopathic remedies. Some people say avoid all essential oils with homeopathic remedies. I think it's a case-by-case situation, but peppermint and black pepper are two that I think are especially important to avoid with homeopathy. And because it's an antidote, it won't hurt you. It will just take away the benefits of the homeopathic treatment you're on. And also, this is one that's not indicated when you have high blood pressure. Okay, so frankincense is one you just have to have in your birth kit. It's because it's good for so many things, and I especially like that it's the Be Here Now oil, and it's very grounding, and it just brings you into the moment. So especially for like parent-infant bonding, and then after birth, it's so good for inflammation, especially in the brain. And when the baby's born, this is why they anoint babies with frankincense, and that comes like back from the Bible and a lot of other historic references. But This one helps with brain inflammation, basically. So that's especially important for the baby, and it can just be used diffused for the baby, or you could, dilute it. And like I said before, how to do that, and then anoint the baby on the top of the head. And anyway, this oil is so nice because you're just in the moment with your baby more. And let's get off our cell phones, mamas, if we can, when we're nursing, and try to be more just present. I know it's hard, but this one might help you to do that. I think it's a really nice one. And frankincense contains more than 200 molecular compounds, offering a wide range of benefits. These include inflammation, brain fog, infections, colds, skin conditions, stretch marks, eczema, acne, tears and wounds. This oil is helpful in pregnancy and labor for lower back pain, nerve pain, labor pain. It may tone and strengthen the uterus, particularly during labor when a mother is fatigued. So a great one to bring in. I had you guys at the beginning try peppermint and frankincense together. So that's a great one during labor when there's fatigue, or just anytime in postpartum. It can be used to support the perineum before, during, and after, or not after, before and during birth and the birthing process. And it also can help with fear. And I have a couple other notes here. Okay, so in one research study, frankincense was found to be useful for extreme anxiety during transition in a hospital study in New York of 25 laboring women. That's from Swindle 2001. So this is one that I also recommend for the transition phase because of that study. So peppermint and frankincense, again, together, amazing for transition. And I think I had one other one. Oh, yeah, it's good for cleansing the birth room. So to mix this one with orange in the labor room to help cleanse the air is a really nice kind of uplifting and grounding at the same time effect. Avoid with asthmatic women or people and those with a negative association with a scent. So, and some people do have that. So the scent is unique and it's kind of strong. So if you're someone preparing for your own birth or someone else's, I recommend like smelling all the oils first and making sure that you like what you're using. I think this is the last oil, and clary sage is a wonderful addition to labor and postpartum, not for use during pregnancy, but it's amazing for regulating contractions and helping with labor pain. And my partner in my first pregnancy, he suggested that I put clary sage in my bath when I was in labor. And I was terrified. Like, again, I didn't know much about essential oils then, obviously, but I was terrified because I'd only heard that it increases contractions and increases labor. And I was like already, like just trying to cope with the labor I was experiencing. What I didn't understand that it at the same time is making your contractions stronger and more effective, it actually lowers pain or the experience of pain. So it's just awesome. It's kind of like oxytocin for labor. But I would also say that if your contractions are already strong and already regular, then you should quit using it because it's done its job. Switch to a different oil for pain. It's really better for getting labor started and getting it regulated, and then switch to a different oil because the contractions can become too strong or too close together with the use of this oil. It's very potent. Somebody's commenting on my live Facebook. So I'm doing this as a Zoom call. And if you wanted to get on the Zoom call, or you can watch the recording later with the Zoom call, then you can go into events in the Facebook group and you can find the link for the Zoom call. But we are wrapping up soon. So sorry for those of you who don't get to see the slides. So clary means clear, and this oil can be thought of for all types of clearing, cleansing the air in the birth room, clearing brain fog and sinuses, and facilitating to help clear a baby. Clary sage can be used aromatically and topically to encourage and regulate contractions, increase mental clarity, and decrease pain during labor. So in postpartum, it's best known for after pains and encouraging first lactation. So once lactation is started, I would think of other oils than this to keep it going, but this is the one for the first lactation a baby has. It also is helpful if there are a lot of night sweats, for balancing hormones, for respiratory health, irritability, moodiness, and postpartum blues. This oil is the most sedative of all essential oils that we have, so it's a nice one for sleep. I use it for sleep still all the time. So make sure you're using Salvia scalera and not Salvia officinalis. Avoid until the mother is at term, Or like if the baby's not in the correct position, you don't want to start using something that could help your labor progress or contract your uterus. So make sure everything's aligned before you start using this in the third term. And avoid alcohol and heavy postpartum. When you have heavy postpartum bleeding, it's best to avoid this oil. So I don't have time to do Roman chamomile, I'm sorry. But I want to wrap up just by showing you. So this little booklet of mine is under $10, and this is basically, it was the handout for my e-course when I first decided to share this information. I just studied everything. I moved out of my clinic and studied everything for like 2 years intensively. And I put everything together into a continuing education course for midwives and birth professionals. And this book right here was my handout for the course. So it has all my charts and graphs, and it goes into which carrier oil to use for what and how to use the oils. And then there's just big charts with indications of how to use each oil. And it's basically just a kind of a user's guide, and it has everything you need to know about using oils through infant care. This is my newest book, and this goes into more detail. So if you want to understand why and have it more written out, like why and how to use it. So I start from the very first symptom I had in pregnancy, which is nausea, and go through all the most common symptoms of pregnancy, which oils I recommend, how to use them. I also give nutritional advice for these different things and explain why you're having them. So why is there back pain, in early labor? Like, why is there nausea? What's going on in the body? And then I do go through all the labor, postpartum, nursing, and infant care also. And then in the back, I highlight some of my favorite oils and tell you how to use those. So it's a really good user guide for people who haven't used oils in maternity. Maybe you already love oils, maybe you're new to oils. It will work for both of you. The chart that we're going to be providing for those of you who've signed up through Eventbrite will be excerpted from this book also. Okay, and finally, that online training course I did for midwives, I later turned into an e-course, and it is a certification e-course, even if you're not a birth professional or acupuncturist or someone in the US only, I'm sorry, at this point. US only is how I can give the credits, but you can still be certified as having completed the course and being proficient. There's 5 quizzes, there's a bunch of handouts that go with it, and it's basically a series of like 5 keynote modules that explain in a lot more detail than I did for this quick intro how to use oils. So if it's something you want to teach or you just want to know more about it for yourself or you're a birth professional, it might be a great option for you. And I have the prices off, taken down by 15% through this Sunday using this code OCT2020. And I will be providing links. That's on my website, dailynectaressentials.com. But the person who invited you to this class will be sending you a follow-up email with a unique link and the code and all the information that you need to have. So this is my contact information. I'll keep this up for a few minutes. Please follow me on Instagram. I travel a lot and teach all over the world. So even if you're not in the US, you might get to see me talk someday, and I'd love to meet people on the call. And then also have a Facebook group where you can just be more of a community member and contribute, and those are written below there. And I'm going to hand things back over to Zarine.
All right, so we'll just keep your contact details up so that anyone can either jot those down or grab a screenshot of those. But again, this will be recorded. As Stephanie had mentioned, we will be sending you out the recording. So depending on whoever's link you'll clicked on, you'll get all the links to basically all the resources that you saw. So the course, if you're interested in taking a more in-depth course, I've taken it. It's amazing, phenomenal, a lot of good knowledge. Even if you aren't a doula or a midwife or a birth care professional, just even as a mom, if you're looking to integrate essential oils into your daily care for pregnancy or even for your kids, it's a great course to have just to kind of get a better understanding of what oils are safe and which ones are the best ones to use for what. So that's a great alternative. Also, links to all the books that we're going to be having. We are going to be starting to have these books issued out locally in India as well for anyone else that has joined. And the other promotion that I have to offer is anyone in either US or Canada that is going to be enrolling across the board, whether it be with Stephanie, whether it be with myself, or anyone that makes a purchase of over 100 product volume, automatically will be getting a free Easy Air or a Breathe touch roller, which is really nice for respiratory support And especially as the weather is changing, it's a great one to have. And that comes as like a 10 ml roller bottle that you can just kind of keep in your purse and carry with you. So if you guys will take like a couple minutes to go over any questions, if there are any. I don't have any other questions that were pending, but if you guys want to either take yourselves off mute and we can kind of open up the conversation, or we'll give you guys a couple minutes and then we'll end it after that. Okay, I don't think anyone's coming on. Do you have any questions from your Facebook Live that's coming up?
No, no questions. Well, people just saying what they could see and not.
All right, yeah, so even for once we get the recording up, we can share it across the Facebook group so that way everyone has access to it. That way they can rewatch it with all the slides and get all the benefits from there. So I think we're all set then. We will see you guys. Feel free again, reach out to any of us if you have questions, and we'll be more than happy to guide you across this oil journey of yours. Thank you all for attending.
Thanks,
Bye.
everybody. Bye.